Hello, everyone. In this episode, we have the privilege of speaking with Michelle LaFontaine, an incredible person who has not only dedicated her career to supporting grieving families, but has also had the courage to open up about her deeply personal stories of loss. Michelle is a regional program manager at the Pregnancy and Infant Loss Network, which is part of Sunnybrook Health Sciences Centre. PAIL is a provincial initiative committed to improving bereavement care and providing free, compassionate support to families across Ontario who have experienced miscarriage, stillbirth, or the death of their baby. What makes this work so profoundly meaningful is that many on the team, including Michelle, carry lived experiences, allowing them to connect with the families in an authentic and deeply human way. 1 in 4 women will experience miscarriage, yet this reality is rarely acknowledged openly, leaving families and even healthcare providers struggling with silence, stigma, and uncertainty. Michelle brings honesty, wisdom, and hope to this conversation, helping us better understand how to support families, how healthcare providers can approach these difficult situations, and why we need to break the silence around pregnancy and infant loss. This is a masterclass in compassion, vulnerability, and navigating some of life's most difficult moments. This episode contains references to pediatric and infant cardiac arrest. These topics may be distressing for some viewers and listeners due to their sensitive and emotional nature.
So you will have an impact, and it's up to you whether or not the impact you have is positive or negative. And you can make a difference with the words that you say and the care that you provide. You maybe can't change the outcome. So I knew that there was nothing that the physician or the nurse or the ultrasound technician could do to stop this pregnancy from ending. But the words that they used, even in the hospital, when I was saying, I'm so scared that if you do surgery, that I'm going to lose this fallopian tube, I'm going to lose this tube. And the doctor saying, it's not a prison. You can leave anytime you want.
We start off with a quote.
Sure.
Pregnancy loss is still lost. When
Yes.
patients say, what next? How do you respond to it?
I mean, that's a big question because it depends on the person what's next. So it depends on their experiences up to date. It depends on what they want. And so I think something that we like to talk about is how this experience can feel universal, but it's really important to individualize it to each person.
So there's a lot in there.
That's a lot. Yeah.
That's hard to navigate, and it's all contextual to each and every circumstance.
Yeah.
How do we train that as a skill?
Listen, I think that one of the things that we often will talk about is how you can take your guidance from the family. And so the family will be looking to you for some of that information that they need. The questions that they are going to be asking will come to you. And then you can listen when you've asked them a question. So try to mirror what the family is experiencing. And if they talk about this as a baby, then you talk about it as baby. If they use a baby's name, then you can use the baby's name. I think language is really important to think about. And so terms that might feel comfortable in your clinical training to use, things like spontaneous abortion or fetal remains or products of conception, this is their baby that we're talking about. And so to really keep that, human aspect to it and recognize that for many, many families, the loss of their baby is never something that they've even thought about. It will come as a complete shock to them. And so anything that you can do to offer them some of that anticipatory guidance about what they're going to see, what they're going to feel, what's going to happen next is really, really critical information for them to have. And to repeat that more than once. So to be able to give families information in the best way that you know how. And when you don't know, you don't know. So if a family is asking you, something that we have heard from first responders in the past is when families ask them, is my baby going to be okay? Or is my baby going to die? And the truth of the matter is you don't know. And sometimes you can just say, we're going to do everything that we can to get you to the hospital as quickly as possible, or something that lets the family know that what they're doing now is all that can be done. We have also heard from families that the waiting makes them feel like nothing is being done. So why aren't you doing anything? So for you, that this family is 9 weeks gestation, experiencing pain and bleeding. You know clinically that there's nothing that can be done to stop this pregnancy from really not continuing in the way that the family was hoping that the pregnancy would continue. But for families to sit there, if no one has told them that, if no one has said that, we need to have an ultrasound, we're going to check levels, babies at this age typically won't survive. Like there's just lots that I think you can provide for families that will offer them that information to help kind of set expectations in a gentle way.
So if I hear you correctly, because there's a lot of nuance in there, it's to humanize the situation. Because I think it's so natural for healthcare providers, paramedics, nurses, doctors to use a lot of medical terminology. And you can see where they don't have that education. And you're kind of dehumanizing the experience. So that's why it's so important to hone in and to say it, like baby, like near them. Do you want to see your baby? Do you want to hold the baby? Because if we say products of conception, it's a very medicalized, demeaning term. And reading that in your slides and presentations, like it's so true because we hear that term all the time.
Yeah.
How would that make someone feel?
So I think for families that hear a first trimester loss be referred to as a spontaneous abortion, for example, that's really jarring to them because the way that we typically use the word abortion in our circles in kind of society is not to describe a well-timed, wanted pregnancy that's ending. Abortion is used to describe an untimely pregnancy. We don't know if the pregnancy was wanted or not, but it's not something that the family chose to continue with at that time. So when a family hears something like fetal remains or spontaneous abortion or something, that takes away from the fact that that is their baby that we're talking about, and often leads to more confusion when someone, so in my personal experience, I can tell you I had a 7-week miscarriage that ended up in an ectopic pregnancy. And when I heard them talking about spontaneous abortion, then I felt like, you must think that I didn't want that baby or that I did something to prevent that pregnancy from continuing. And so words matter in terms of how a family will be able to process that experience. So words that you can use, again, to mirror the family's experience. If they are talking about their pregnancy, then that is a good way to continue to refer to what is happening. If they talk about their baby, then that is a good way to continue to refer to what's happening.
Thank you for sharing that. And correct me if I'm wrong, that was over 20 years ago, you experienced that?
Yeah, that was my first pregnancy. I was 7 weeks pregnant and experienced pain and bleeding and really just thought immediately that that's what was happening, but was desperate to do anything that I could to keep that pregnancy. So yeah, that was my first experience and something that I completely felt glossed over. That, this was very much, you're still young, you can have more kids. This must have been something wrong with that baby for the pregnancy not to continue. This is nature's way of weeding out babies that would have had problems. Not at all recognizing the loss. There was one person that I remember coming to visit me, and she started to cry and said, I recognize that this was something that you really, really wanted, and I hope that you'll be able to have a family of your own. But that was the only person that really kind of recognized how important that pregnancy was.
There's such good points there because you still remember over 20 years ago the wrong things they said.
Yeah.
And how that made you feel.
Yeah.
For a long time. And we can't undermine the impact what our words do. Because even though healthcare providers come in, we see patients all the time, for somebody, they could remember something you said or did for a long time.
Well, and I think I would go even further to say not that just they could remember, but they will remember. good or bad. So you will have an impact, and it's up to you whether or not the impact you have is positive or negative. And you can make a difference with the words that you say and the care that you provide. You maybe can't change the outcome. So I knew that there was nothing that the physician or the nurse or the ultrasound technician could do to stop this pregnancy from ending. But the words that they used, even in the hospital, when I was saying, I'm so scared that if you do surgery, that I'm going to lose this fallopian tube. I'm going to lose this tube. And the doctor's saying, it's not a prison. You can leave anytime you want. And so I think, okay, that was not something I expected to hear from a physician. And yeah, that was 20 years ago. And I can tell you exactly the room I was sitting in and what was on the wall when he said that.
That's hard to digest that you were told that.
Well, do I think that he meant it? Meant harm to me? Absolutely not. I think that's the other thing that we, as parents who've experienced loss, there's a recognition that no one went to work that day thinking, I'm going to say something that's going to wreck that family. Absolutely no intention, but there is a gap that exists between the intention of what a healthcare provider says to a family and how that family receives it. And so it's really so important to just take a minute and think about what you're going to say to that family. And the hope is from the education that we provide and from the information on our website that you'll be able to get more and more comfortable with what to say in those situations so that it starts to come more natural and feel more comfortable so that you're not stuck in the situation thinking, I don't know what to say. And what I don't want to do is say the wrong thing.
Because if I'm hearing you correctly, people are inherently good with their intentions. They truly want to be, but there's a gap. I feel the gap.
Yeah.
We all feel the gap because we don't have really rigorous training in it. And this is why I'm so glad you came on and you have these resources. And if we go back to when you said this is nature's way of weeding out if there isn't any abnormalities, was that actually said to you?
Mm-hmm.
So these platitudes that we think seemingly are beneficial, but deep down, like, that's hard to hear.
Yeah.
Because tell me this is how you feel, because just reading about this, and just as a parent myself, as soon as you're pregnant or your spouse is pregnant, you have visions.
Yeah.
This is what they're going to grow up to be. They're going to do this. I can't wait to go to games with them. You start developing their future, then all of a sudden,
yeah,
it's gone.
Yeah. And I would say even before the pregnancy, so I was a little girl imagining myself as a mom, playing with dolls, trying to emulate what it'd be like as a parent. And as soon as we got that positive pregnancy test, you already start to jump into the future to think, okay, so by Christmas, I'll be this far along. That's going to be so fun for all the rest of my family to know. I will, by the time this happens and the baby will be this old, we have a wedding to go to. Am I going to have to get a different kind of dress to wear to that wedding? All of the things that start to change and your identity as a person. You kind of move from being just you and your partner to thinking about you as a parent, and a whole different world opens up to you when you're a parent. It's a whole different place that you have access to that people who are parents don't think about, don't know about, don't anything. And so I would, for us in particular, we had a very complicated reproductive journey. And so anything that we did was very planned, was very wanted, was very expensive. And so we knew that we kind of had a limited number of options for us to be able to grow our family. And I did not think for 1 second that there was anything that might happen to a baby that I would decide to no longer continue that pregnancy, or that I would. So when people would say things like, there must have been something wrong, then I would think, well, what could possibly have been wrong that I couldn't still parent and love that child? So I think one of the things that we hear often is that those platitudes come from a real genuine place of wanting to make you feel better, And because you don't know what to say, so you might say something that comes out a little clumsier than you would like it to. And if that happens, there's always a chance to go back and say, you know what, earlier when I said, at least you could still have more kids, I really didn't mean the way that it came out. What I meant was, I hope that I know that you wanted to have this baby, and I hope that you will be able to in the future. And I'm so sorry that this happened to you now. That feels 100 times different than at least. At least you're still young. At least you can have more kids. At least you already have a baby. Those kinds of things that are said are very minimizing and invalidating. But if you can go back and correct it, then that also would tell me that you really spent some time thinking about what you wanted me to feel in that moment. And it's okay to make a mistake. It's okay.
Because they are difficult conversations. And it goes back to someone contacts each and every someone. And we may say something that's not the best way to measure it, but it's very unique to see that, oh, you reflected and you changed and you apologize.
Yeah.
That leaves a lasting positive impact on people.
Yeah.
And that's such a good point that you tried so hard for your pregnancy, and any negative comment that dismisses going through just compounds everything that you have experienced.
Yeah.
To try to get to that point.
Yeah.
And that's hard. And the main thing I took away too is that when you say things, oh, at least you're still young, you can still get pregnant, or there must be something wrong. It's like you're making it seem like my baby's interchangeable with someone else.
Yes. Yes. So I will say that still happens now. So I do have 2 living children now. And it's happened in this role that I have been talking about my loss. And when someone learns that I do have living children, it's almost like then you're like, okay, well, that's okay then. So you're okay now because you did go on to have other children. But the baby that I lost is irreplaceable. And will always be missing from our family, and will always be loved and wanted and missed. And so it doesn't matter if a family goes on to have 10 living children, the baby who died was still meant to be part of their family and is missing from their family. I'll say too, when something happens to a family and a healthcare provider says something that inadvertently causes harm or upsets the family or something, it's often witnessed by another healthcare provider. So it's not common that you have conversations with one healthcare provider with nobody else in the room. Oftentimes there's perhaps a nurse and a doctor, or a paramedic and the handoff to the nurse, or something happens where there's more than one person. And so I would also encourage you in those moments, if you hear a colleague say something that you think, ooh, that might not have come out the way that they wished it would have come out, I think in the moment it's also okay to offer some correction in that conversation. So if your colleague says to a family, this is a spontaneous abortion, there's nothing that we're going to be able to do, and so we're just going to get you to the hospital, then it would be okay, I think, for you to then say, what he means by spontaneous abortion is something that we would call a miscarriage. That's a medical term that we use. But for you, I know this is a loss of your baby, and that we are going to do everything we can to get you to the hospital where we know that you'll be well taken care of. I think that kind of changes the narrative and might give a clue also to your colleague, like, ooh, right, I don't think I meant to say that. But I do think that any professionals, you kind of get into a habit, or you just kind of do what you know to do. And those terms are more comfortable for you to say because that's what you were taught that this is. So I do think it's okay in those moments to even offer gentle correction to one another, and then to talk about it together afterwards, to say, when I jumped in to say that, it was just because I know from training that I've had or from something that I've read that this is a more gentle way to talk about that with a family.
It's very good, actionable advice. How do you think face comments apply in these situations, like saying they're in a better place? What do you think about that comment?
So I would say there's no better place for my baby to be than with me. And that's making a lot of assumptions about that person's faith. So again, really trying to mirror how the family is feeling and talking about it, not making those assumptions. And sometimes the other thing that we'll talk about is this acronym, WAIT. Why am I talking? So before you're about to say something to a family, think about what your intention is with your words. Think about what information are you trying to convey. And if it's really just that you feel horrible this is happening to this family, then you can just say, I feel horrible this is happening to you. I'm so sorry that we're meeting under these circumstances. And there's nothing required of you to try to recontextualize what is happening or why it's happening. Because oftentimes there's no why, there's no answer to that question of why this is happening. Miscarriages are very, very common. And we know that 37,000 families a year in Ontario will experience the loss of their baby. That's a lot of families that are affected and deeply affected with that ripple that goes through the rest of their life, the rest of their family. And so I do think that it would be an important thing to really kind of stop and think about your intention. And so, yeah, we like that acronym WAIT.
That was going to be one of my next questions. Where does silence come in? Does silence have utility in these circumstances?
Yeah, I think silence in connection does. I think silence in awkward, I don't know what to say, I'm going to pretend this isn't happening and just look out the window and hope that I can hand this patient soon, feels very different than silence in connection. And so that's something that we also like to try to focus on, that we know there's no perfect words that you can say that will make this pain go away for the family. But the words that you do say, when you say them in connection, when you say them with comforting presence. And so your presence, whether you're talking or not talking, is something that the family will also feel. In my stillbirth, I was transported from my local hospital to a downtown Toronto hospital, and remember feeling badly for the paramedic that had to sit with me and thinking they probably, I don't know how did you decide that? How did you decide who had to sit in the back with me and who got to drive? Because I bet this person would rather be driving than sitting in the back with me. And not once did he make me feel like that. Not once. So sitting in that 45-minute drive on the Don Valley, trying to get to the downtown hospital, he didn't say a lot. And I never felt uncomfortable sitting back there with him, because I think we had established his tone was very gentle whenever he spoke to me. He would give me updates along the way, like, we're about 20 minutes out now. And when we got to the hospital, very kind of quietly put his hand on my shoulder and said, I really hope things work out for you.
It's 20 years ago.
20 years ago, yeah.
And all these little gestures that are seemingly very simple things to do, you still remember them.
Yeah.
And let's break that down, because I've seen this anecdotally, we all have professionally. It makes everyone feels like they have to say something, solve the problem. Can we, or should we even solve the situation? Or should we just be there with connection?
I mean, if you can solve it, solve it. If there's something you can do, then do it. But I think most of the time there isn't. So most of the time, your role is to get them to the place that could maybe fix a problem. And that, again, that is very individual. And so you'll solve whatever problems you can solve. If there's anything that you can do, you have all the clinical skills that you need to run that call. You know exactly what to do. There is no question that families are getting excellent care the second that paramedics are on the scene. What families are lacking is when there isn't anything that you can do, and you still have to be with that family. So it's really about the communication that you can have with the family that will make the biggest impact for them, because most of the time, babies won't be saved in the time that they're with a paramedic. I would say most of the time. And maybe I'm wrong. Maybe there are clinical situations that you come across more often. But for the most of the families that we talk with, the paramedics were part of their journey, but that wasn't the time that anything was decided. That wasn't the time that things really changed. And yet the impact that was held in those conversations. So I don't know that there is something that you can say to solve it, and recognize that clinically that's where your forte already is. That's where, so we don't need to worry about what's happening clinically. We do need to be concerned about what's happening emotionally with the family. And something that we hear from paramedics is what's happening with them emotionally as well. So as a parent, as someone who maybe thinks about your own children or thinks about your own experience of loss, it's very common. And so it's quite likely that whether it's happened to you, it might have happened to your family, to your sister, to your mom, to your best friend. And so how I think sometimes that the job is then for you as the professional to try to figure out how do you deal with what's coming up for you personally, and still allowing yourself to connect to that family, even though it might bring something up for you. So I think that could be another whole conversation really about how to manage your own personal experiences in those times. But I think if there's something to solve, we know you're already going to solve it. The communication is not a problem to be solved.
There's a common theme talking with all the specialist experts like you, where they say the medicine's easy. Communication is the hard part. And I think that's such a good point to linger on when you're saying miscarriage is very common. It's about 1 in every 4 females will experience one, right?
Yeah.
And it doesn't just affect the female, families, friends. And imagine a paramedic has experienced a miscarriage and they do that call, and now they're wrestling with a lot of emotions while trying to maintain professionalism.
Yeah.
What should they do in that circumstance?
So I would question what does that look like to you to maintain professionalism? Because I think that that we kind of talk about therapeutic self-disclosure. And so when would it be okay for you to let a family know, this has happened to me too? I'm so sorry this is happening to you. When would it be okay for a family to see that you are a human too, and that you can connect with them? Sometimes we hear from professionals that the emotional toll that takes for them to allow their own emotions is too much. And so it's easier to try to turn off, to try to separate. But that is happening at the cost of that relationship that you're having with that patient. And so if there is a way for you to allow yourself to be human in that situation, I think it means a lot to families when they can see that we know that the medicine part is being taken care of, and you're also going to take care of the emotional part too. There's a quote from a mom who experienced a miscarriage that said that we can recognize that miscarriage might not be a physical emergency, but it is an emotional emergency. And so that does need to be paid attention to. And I would say that it's okay for you to show that emotion to the family. That I think that would really mean a lot to them, to see that you can recognize how impactful this is for them too.
The information provided is for educational purposes only and should not be considered medical advice. Viewers must follow their local paramedic guidelines, clinical standards, and applicable laws when providing patient care. Always practice within your scope of practice and seek direction from authorized medical oversight when required.